those doctors, those hospitals, they're just going to ask me for money and ask me for money and ask me for money and ask me for money. Hello and welcome to the Hi-Fi Health News Podcast. I'm Erica Grotto. You've heard before on this podcast that healthcare is personal. And although my guest today works in the industry, our conversation was much more about the patient experience than the business side of things. I met Navesh Kandiyil, a physician who now works on the business side of healthcare, at HFMA's annual conference in Denver. But when we started talking, he referred to himself first and foremost as a patient. And that's what has driven his approach to his career. Having been on the physician side of it and on the business side of it, that's got to be pretty interesting. And sometimes those perspectives might not be in agreement, right? About the way things should be done. What would you say are the biggest complaints that you've heard from patients about the financial experience of their care? Because I hear a lot about like, my doctor was great. The clinical care was great. I feel amazing. But now I have this bill that I have to deal with. What do you hear about?
So I live on an analogy. So everybody knows me, knows that I go down this rabbit hole, right? So pick a restaurant you go to that you like. You go have dinner, you have a wonderful time, have some wine with your partner. The food experience is awesome. The restaurant is awesome. Everything about the evening is awesome. Pay your bill and you come home. And about a week later or a month later, you get a phone call from the restaurant saying you owe them more money. Or you get a bill on your credit card statement that doesn't match what you paid them.
Yeah.
That would usually never happen in our normal lives. But that's what happens all day, every day with healthcare. Because the interactions, as you expressed, are usually really good for the most part. There are some challenges with access and getting in on a timely fashion or who you want to see. But the financial aspects of this are not as transparent and well documented or well explained for patients. So then the vast majority of what I hear from patients is, why am I getting another bill? Who is this from? I thought I paid this.
Yeah.
I thought this was already done. Why is the doctor's office calling me, the hospital calling me? Why is the anesthesia group calling me? Who's this other insurance company? The worst by far is when somebody gets hit with a creditor calling them because they never got a bill in the first place and they were reported to a debt collection company.
Yep.
So you have your various array of challenges that patients face. And the problem for the providers is that they don't have visibility to what's going on with patients in this element of their experience. So that hurts their relationship too, because now the patient has a chip on their shoulder because they may believe the provider should have known and they should have been able to manage. And it becomes way more complicated than buying a cup of coffee, like I said.
What can patients do about this? How can they stay on top of these things? How can they simplify things for themselves in a system that is not going to do it for them?
I think education, self-education, patients spend a lot of time on the internet, period. And I think as humans, we all use it for various reasons. I think getting aware and more aware of what healthcare is and what we need it for, or our insurance and what it covers or doesn't cover, getting familiarity with the doctor's offices, asking the questions that are necessary. We talk to everybody about everything. We post everything about everything. So we might as well ask about this as well, because it has to do with our lives. Just getting more aware of things. And here's the challenge. Being aware doesn't necessarily make it all go away. It just makes you more aware. Talk to people who know more about it. Ask the right questions. The late Marshall Allen said something which was really important. Never pay the first bill. Best books a patient could ever buy. Get an understanding, because my late father got a bill from a health system that he was at 6 years after an encounter.
Wow.
And I chuckled at it because I was like, wow, you had your cardiac cath back in so-and-so year. Why are they approaching us with a bill today? And the system is not flawless by any means. It's complex. So again, becoming more and more familiar about what your responsibilities are or expected to be at the time you're getting care or even before. So a visit, it's hard enough. What's your copay? What do I do? What's my deductible? But it gets harder and harder when you up the ante. If you're going to have a surgical procedure, is the anesthesiologist covered under my insurance, or do I have to pay them separately? Is it unemployed? Do I need to get a prior authorization, or does the hospital do that? Does somebody else do it? And if you can manage that in the best way possible, how would you do that? And they don't know these things They're not expected to know these things. So as much as I implore the patients to become more familiar, I also, this conference is a perfect example of put the patient at the center of it.
Yeah.
Let them be the ones to tell you what's wrong. We're looking at it from the financial aspect of it. You asked the question about clinical care, but it's about an individual. And unless you are a patient or have a care for a loved one and recognize how complex it is, then it doesn't become personal. Once it becomes personal, it takes on a whole different meaning. And hopefully you try to make it better, not only for your loved one, but for others who may be in the same situation.
Yeah. And something that I've heard over and over and over from folks at this conference, other conferences I've attended, people who have worked in this space for a long time, is that it's all business until your loved one gets sick.
Absolutely.
And what ends up happening is, if I have trouble with this, then what hope does someone who doesn't have decades of experience
Absolutely.
have to figure all this out? So how has your work changed your approach as a patient, or changed your approach in working with patients?
Yeah. Sometimes it's more frustrating, right? So a simple thing, and I'm a LinkedIn junkie, so I posted this a few years ago. I had an annual physical done, and they wanted to charge me for the physical. I confirmed with my insurance company. They said, no, it's an annual wellness visit. They don't have to bill it. Contacted the doctor's office. They said the same thing. They said, no, we booked you for a physical. The provider is literally a friend. I've known him for 25 years who did the physical. He said, I documented it as a physical, but the office billed it and coded it as a regular visit and wanted to bill me for it. This went on for a year and a half, arguing back and forth about what type of visit it was. They knew what it was, but they wanted to code it in a certain way. So the frustration level that comes is, it doesn't matter what you know or don't know. You're always going to run into somebody or something or a process or a challenge. It shouldn't be that complicated. Patients don't know this. It makes it a lot harder. How can we make it easier for them? And if it's happening to me, as I'm using myself as an example, how many other people are dealing with it? How many other people are having to deal with problems associated? The more important thing, I think, Erica, the part of the conversation we're discussing right now is finance and money. What people don't realize is that the situations that led them to be in the situation were when a patient was at their most vulnerable point, when they were ill.
Yeah.
That's not a feeling that anybody enjoys. If you've ever been sick, or if you've ever seen a loved one sick, your primary goal is to get them healthy, better, faster, and not have to worry about the financial element. So imagine if somebody's having to worry about getting better, staying better, and worrying about whether I'm going to be able to afford a bill that lands on my lap.
Yeah. Yeah. So I hear everything you're saying, and I wonder if people watching are going to go, boy, you're right. Those doctors, those hospitals, they're just going to ask me for money and ask me for money and ask me for money and ask me for money. Now, I have been here at this conference long enough, and I've been around these folks long enough. I know that's not,
No.
it's really, I've yet to meet the healthcare executive who's sitting up in his office, twisting his mustache and saying, how can I get more money
out of the patient, right?
Yeah. So, but these things do happen.
Absolutely.
Mistakes happen, oversights, all of those kinds of things. So what is your best piece of advice there to help people stay on top of these things?
Work with your insurers, because they are the ones providing the coverage, whether it be Medicare, whether it be your employee-based insurance, whether it be Medicaid. They have an idea of what should be, shouldn't be covered. Work with your doctors to know what kind of coverage you're getting. Look at every bill you get, have clarity over why it's being asked. Anytime somebody asks you for money, or whether it's an explanation of benefits, get clarity on the why and keep asking. And you'll be surprised that a lot of those bills might disappear because somebody, as you said, may have made a mistake. Erroneous. Don't ever pay the first bill. God rest Marshall Allen's soul. Did phenomenal work when he was here. And that work continues through people I know. And Andrew, you're out there, making a shout out to you. Continue that work and continue to be the advocacy for patients. And then patients need to understand it's complex for everybody. It's not as simple as black and white, that the health system or the payer or the providers are intentionally coming after them. So I think everybody needs to look at this and say, nobody wants to be here. Nobody wants to. This was the most vulnerable point in possibly any patient's life, is to be sick. Think of yourself sick. So let's humanize this before we make this all about money and or just care alone. There's all other elements of this. Again, education. Ask, resources, talk to your insurer. Insurers don't like this because at the end of the day, you're a member. And if you're a member and the member has a bad experience, the member has the right to choose a different carrier when period time comes around. So use the resources at your disposal to become as informed, but never stop asking.
Yeah.
And make the time for it. It's your health, it's your well-being, it's your money, and you also want to make sure you're in the right hands.
That's it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.